America's Frontline Doctors is a group of doctors who aim to dispel misinformation aimed at COVID-19. They gathered here today in Washington, D.C. in front of the Supreme Court to give that information to the American people. After the event, I had an opportunity to speak with some of them, and here's what they had to say.
Early treatment is what we need. It is effective. It will save lives, so we need early treatment. I created a telemedicine platform called myfreedoctor.com, where I'm treating patients for free in all 50 states. All they have to do is go to my website and track me down.
We just aim to bring truth and information to the American people. Early treatment works. There's a lot of early treatment options. Masks don't work. If you want information on both of those things, they're on our website.
We need to stand up and talk about Section 230. This is something that these news organizations, these social media platforms specifically, cannot be allowed to act as publishers while still being protected by Section 230.
Well, I mean, the CDC just actually came out with these numbers in July, and they showed that of the people they looked at with COVID, 85% had said they'd been wearing a mask always or usually. Now, what does that tell you? Only 3.9% of that group said they never wore a mask. If masks worked, you would see some different numbers. In fact, the control group, that group, same numbers. So 85% of people are wearing a mask, and it's not necessarily doing them any good.
We've treated 1,900 positive patients with the successful use of hydroxychloroquine, zinc, and either Zithromax or doxycycline. We have had one hospitalization and a 0% mortality rate. And we noticed that treatment early, within the first 2 days to 3 days of diagnosis, had that high success rate.
I'm a child psychiatrist in West Los Angeles. All of my kids are scared. And I've been noticing that around the country, this fear has morphed or devolved into something even more eerie, which is a state of delusional psychosis, this belief that we must keep everything closed, we must hide, we must mask ourselves in order to save lives. And I'm very, very concerned that that mental illness, that hysteria that's overtaken the country is moving into something even more sinister, which is social control.
People need to know that there's early treatment that can be successful, and they need to put their foot down and demand early treatment, because I don't think, after everything that's happened, I don't think it's going to come from the top down.
Right now, they're still trying to drive the narrative that we have a pandemic going on. We don't.
I think that the media has largely spread disinformation about the virus, and I think that this is a very treatable condition if treated early and aggressively. And so that's what I've been doing in my clinic with enormous success.
The greatest thing is, see your doctor. I mean, our patients were told, stay at home, don't call your doctor, don't see your doctor. I'm a pediatrician, so I'm on the front line to keep our kids safe and prevent disease and treat disease.
The biggest message that they wanted the American people to take away from today is that you don't need to fear COVID-19. Doctors are capable of treating you, and if you have any concerns that you could be sick, talk to your doctor.
Hello, everybody. I'm Dr. Simone Gold. I'm a board-certified emergency physician and the founder of America's Frontline Doctors. I'm also a Stanford University educated attorney, and we've come back with some of my group for the second White Coat Summit. We're here to speak to America just like we did on July 27th. At that time, we brought the American people truth and hope and optimism. And we're here to give you more truth and more reasons to be optimistic and to not live in fear. There continues to be a great deal of disinformation and outright censorship. Since our summit, the censorship, unfortunately, has gotten worse. Because of that, we've established a website, America's Frontline Doctors, where you can find the truth, where the truth is not censored. You can also follow most of us on social media. Today, we're going to bring you information about masks, about lockdowns, about, most importantly, early treatment, reasons to be optimistic. We're going to dispel the myths. I want to start with masks, and I start with this because there's a legal crisis, a constitutional crisis that we're not recognizing. And it is, to some extent, personified by the forced, mandated wearing of masks. Let's not tiptoe around the great big elephant in the room. The facts are actually not in dispute. Masks are completely irrelevant in blocking the SARS-CoV-2 virus. If you doubt that, you must watch the educational session that we've done about the myth of masks. I encourage everyone to do their own internet search and discover that prior to March 2020, There were no scientific journals that asserted that masks could keep out a virus. That's simply not how that works. A virus is 1/1000th the size of a hair. Consider what our Emperor Fauci said when asked if he's sure that masks work. Now remember, he is not new to the game. This has been his life's work for decades. There was no chance that what he said was a mistake, and there was no chance that SARS-CoV-2 is different than any other RNA virus, that he has made his life's work. Dr. Fauci said, when you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it is not providing the perfect protection that people think it is. And often there are unintended consequences. What the New England Journal of Medicine, a premier medical journal, had to say about masks, the following. It is clear that masks serve symbolic roles. Masks are lucky charms that may help increase healthcare workers' perceived sense of safety and well-being. Thus, although such reactions may not be strictly logical, we're all subject to fear and anxiety, especially during times of crisis. Expanded masking protocols' greatest contribution may be to reduce the transmission of anxiety. That is per the New England Journal of Medicine. I will put it plainly to you, my fellow Americans. You have been lied to by the media. Propaganda is not a new phenomenon. Thomas Jefferson said, "The man who reads nothing at all is better educated than the man who reads nothing but newspapers." And John F. Kennedy pointed out that it does not matter if the propaganda had a sinister purpose. The great enemy of the truth is very often not the lie, but the myth, persistent, persuasive, and unrealistic. These days, Americans fall into three groups: those who recognize the propaganda, those who have been successfully propagandized, and those who don't care. We'll just leave them out of it for now. My message is for mask believers who have not yet realized that they are victims of propaganda and who also think it is no big deal to force other people to wear a mask. In fact, there are three enormous problems with masks. First, mask mandates are spreading fear and hostility that is changing American culture. We are less friendly, less interactive, more hostile, quicker to be angry with our fellow citizen. Masks are very socially divisive. There is mask shaming and mask virtue signaling. There's hashtag social compliance, and there's citizen policing of sidewalks and airplanes and restaurants. And in addition to hostility, masks bring a palpable sense of fear that is totally unwarranted by the facts. There are actual human beings who believe that others will be harmed if they don't wear a mask, and this is tragic. Second, mask mandates cause an insurmountable civil libertarian issue. In the American legal system, the government cannot force a facial covering because all rights not expressly given to the government belong to the people. The government has neither common law nor statutory right to mandate clothing. Encroaching on a right that belongs to the people is extremely dangerous. One of our founding fathers, fourth president, James Madison, said, "It is proper to take alarm at the first experiment on our liberties. We hold this to be the first duty of citizens and one of the noblest characteristics of the Revolution. The free men of America did not wait till usurped power had strengthened itself." Third, wearing masks is a national security issue. When most of the citizenry of our country can so easily be persuaded to do something that is so clearly against our own Constitution, our enemies certainly take notice. We are quite literally telegraphing our weakness and social divisiveness to our enemies. Now, to those Americans who are genuinely afraid, we are physicians. We are here to help you with these facts to reduce your fear. First, we'll do the facts, then the emotion, and then the call to action. The first is the facts. Notice that what the experts had said for months is wrong. There are not 2 million dead. Our healthcare system was not overwhelmed. There were 10 times the number of ventilators that we needed. Nearly everyone survives, and early treatment works. You must not ignore your own life experience. If all you had to do to stop a virus was hold a tissue paper to your face, your ancestors would have learned this centuries ago, and your grandmother would have taught you this. Second is the emotion. Consider that what President Jefferson said 200 years ago, that newspapers are propaganda, and also what President Kennedy later pointed out, which is that it does not matter if the propaganda is a myth or a lie. Kennedy said, the myth that is persistent and persuasive Realize that just because you believe or feel something is true does not make it true. There has been a massive propaganda campaign to get you to believe something, but you have it within your power to dismiss the propaganda. A simple internet search reveals that no scientist ever believed a mask, let alone a bandana, was relevant against a virus right up until COVID-19. The myth of masks came from politicians, and when something happens in politics, you can be darn sure it's done for another purpose. Third, a call to action. To the mask believers who have been angry at people who won't wear a mask, I call on you now to double your anger, but direct your anger toward those people who have lied to you. It is the people who are angry who have the power to fix the social divisiveness. We need you to put your anger squarely where it belongs. Unleash all of your fury on the professional media complex that has lied and lied and lied to you. And the final call of action to all Americans. So-called experts keep telling you that a bandana can stop a virus that is 1,000 times smaller than a hair. How stupid do you think we are? To all Americans, we say, we will be fooled no longer. The tiny emperor has no clothes. Thank you.
Wow. Hello, America. I'm Dr. James Tadaro. I received my medical degree from Columbia University in New York, followed by 4 years of residency training. On these same steps, 3 months ago at the last White Coat Summit, I talked to you about big tech censorship, how Google was taking down scientific articles, how YouTube and Facebook were censoring evidence-based medicine. But I'm not here to talk to you about that today. I'm not here to talk about the censorship of the present. I'm here to talk to you about the deletion and rewriting of history. Unbeknownst to many, news organizations are deleting articles from the past that no longer fit the narrative today, the narrative of fear, panic, and lockdowns. Case in point, earlier this week, I tweeted out a Forbes article. The Forbes article is called "Why the World Health Organization Faked a Pandemic." It was a scathing review of the World Health Organization's over-exaggerated response to the swine flu 10 years ago. It was a 10-year-old article. I tweeted that out, okay, and based on the content from that article, COVID-19 pandemic would be considered one of the mildest pandemics of the last century. About 12 hours after I tweeted out that article, Forbes deleted it from their database. Not Twitter took it down. Forbes actually deleted their own story from 10 years ago, overnight, when I drew attention to it. And that's going on unnoticed, continually. These news organizations are deleting history. Now this should scare you. This is directly out of George Orwell's 1984. We need to rise up against censorship of the present, but also hold news organizations accountable for their past. Thank you.
Thank you, James. Thank you, Simone. I'm Dr. Richard Urso, and I'm a board-certified ophthalmologist, and I'm part of America's Frontline Doctors. And I got involved because early on in this pandemic, I realized that we had treatment for this virus. Now, my background's in drug development, and I've repurposed drugs for use on the eye, 8 different drugs, and I actually developed a drug that's been patented and made it through the FDA. So I looked carefully at this, and I could not believe that we were going to let patients go without treatment, die, get on ECMO and ventilators. It made no sense right from the very beginning. Anybody who said that this made sense at the very beginning to lock down, it never made sense. It was clear that we had treatment. Now let me explain that. What is this? This is a virus, right? So we get infection, inflammation, blood clots, and breathing problems. Does any doctor know how to treat inflammation? Every doctor does. Does every doctor treat infections? All the time. Does every doctor treat vascular disease and thrombotic episodes? Absolutely. Can we fix breathing problems? Of course we can. Okay, so that's why this whole thing was alive right from the very beginning. Okay, so let me just say that again. Anybody who tells you different, that's science fiction. That's not science. And anybody who tells you different, that's a physician, that's hypocrisy. We're about the Hippocratic Oath, about taking care of patients and making sure we keep them from passing away. Okay, so The next thing I want to talk to you about is what's going on right now in terms of this testing and this PCR and what I will call a case-demic.